So now coming to an interesting section of the topic of portal hypertension is the portal pressure measurement. So what are the different techniques to measure the pressure within the portal system? And this usually happens in a direct way and in an indirect way. But the method that is usually used for the determination of the portal pressure is the hepatic vein pressure gradient. This is an indirect method, and usually there are direct methods too, such as the splenic pulp pressure, and then the direct measurement of the portal vein pressure. It also usually occurs in a very rare circumstances, such as if there is an increase in the possibility that there isn't the hepatic portal vein pressure gradient, and then we can perform these techniques, but it's not recommended as it is very invasive. And other than that, we've got the variceal pressure, but it's not routinely done. So coming to the most common way to measure the portal hypertension, we've got the hepatic vein pressure gradient. So this is a diagram that gives an overview of what actually happens when we are gradiating the pressure within the portal vein. So what really happens is that it requires this sort of a measurement. It requires a difference between the wedged hepatic vein pressure, and then we've got the free hepatic vein pressure. So we need to see a difference between these two different types of pressure within the portal vein. So what really happens is that a catheter is introduced through the inferior vena cava into the right hepatic vein, and then this catheter is introduced in a way that it has gone further until there is a resistance, and it doesn't go any more further deep. What really happens is that the whole purpose is to wedge this catheter within the hepatic vein. So what happens next is that we usually do this through the femoral vein or through the transjugular approach, and this usually forms a column between the catheter and the wall of the hepatic vein. So there is a pressure that is applied through to the wall of the catheter, and then that pressure is usually recommended, and it is noted as the pressure of the portal vein. So as you can see in this diagram, there is a catheter that is going through the superior vena cava into the right hepatic vein. And then there is a more detailed picture over here. There is the catheter that is wedged within the hepatic vein, and it causes the whatever the pressure is applied to the wall of the catheter, it is then noted, and this is known as the hepatic vein pressure. So if we talk about the second type of the measurement, we've got the portal vein pressure, which is more of a very direct method. So we've got the hepatic vein, and then we've got the prehepatic vein, and then the portal vein, and the splenic vein. So this is the portal vein pressure. Usually what happens is that there is a direct contact of the needle that is introduced through the skin or through the transjugular approach. It can also be done intraoperatively in an operation theater. And then the whole purpose of this sort of a pressure is that the needle is introduced, and there is a tip that is introduced into the portal vein, and it sort of causes the pressure to be diagnosed, or the pressure to be measured in this sense. And this usually sort of a technique is done when the hepatic vein pressure gradient is not available, or if there is some sort of a complication going on. And this portal vein pressure is usually done in patients with Budd-Chiari syndrome. So if we talk about the endoscopic variceal pressure, so as you all know that the varices, it's very prone to start bleeding and start rupturing, and this usually occurs when there is an expanding force of the intra variceal pressure as compared to the variceal wall. So the pressure, when it exceeds the pressure of the wall, it causes the varices to burst and to rupture, and thus bleeding occurs within the esophagus. So the method to diagnose the pressure within the endoscopic varices within the esophagus is through endoscopy. So what usually happens is that an endoscope is introduced through the mouth into the esophagus, and then there is the insertion of a needle, or it could also be that at the tip of the endoscope there is a pneumatic pressure sensitivity gauge that measures the pressure of the varices or the variceal wall. And there's also a method known as the manometry endoscopic method. This is also done to measure the endoscopic variceal pressure. And then we've got the splenic pulp pressure. This is usually done in response to check the pulp pressure within the spleen. So this is done directly, and this is the reason why that is very invasive and it's not recommended. So there is a needle that is directed towards the splenic pulp, and then this causes the puncture of the hepatic vein or the portal vein, and there are a lot of complications such as bleeding in this sort of a technique. So that is the reason why it's not very recommended.